Welcome back, COIQ listeners. On today's show, I have Dr. Bonnie Clipper with us, and she is a really incredible woman. I'm really excited to speak to her today. She is an innovation evangelist. She's a professor, she's an author, she's an international speaker, and what's unique about her is for several years now, she's had a laser focus on nurse-led innovation, and this is a topic that I don't really hear discussed very often, and so I'm really interested in diving deep and for us to have a better understanding of what she's doing and how that would impact all of our innovative listeners who are bringing technology to market. So welcome to the show, Bonnie.
Thanks, Roxy.
So first off, for those of our listeners who don't know who you are, give us a little bit of information about your background and what you do. There are tons of letters behind your name, so help us make sense of what it all means.
Absolutely. So I have been a nurse for almost 30 years. I hate to say that. It makes me feel older than I like to be. But I've done this for a while, and I've actually been a chief nurse executive for 20 years. And over the last 5 years, almost 5 years now, I've pivoted into the innovation space to really focus on that. So my background as a nurse, I actually was in critical care and transplant. And very early on in my practice, I knew that I wanted to give feedback and make a change. And what I learned is that as a bedside nurse, you don't always get kind of the uptake or maybe the respect or people to listen to the feedback the way that you believe is valuable. Mm-hmm. So I learned that I had to move up the ladder to kind of get into a leadership position to truly do things that I felt like were going to better the care for the patient, the environment for the nurses. So eventually I became a chief nursing officer and did that for quite a while. I was a Robert Wood Johnson executive nurse fellow starting in 2014. And for me, that was really a catalyst. That's where I began to just learn about innovation. And that was mind-blowing for me. It's a completely different world. It's a completely different nomenclature. Yeah. It's all about sharing and collaboration. So that attracted me. And as a result of that, I was actually asked to apply for the position that was new at the American Nurses Association at the time for the Vice President of Innovation. So I did that for almost 2 years. And actually will just be leaving that position and moving into a different role, a chief clinical officer role of a tech company in a week.
That's awesome. We'll dive deeper into that for sure. I think that because this topic or phenomenon in my mind is so new for some people, let's just start off talking about what do you mean when you say nurse-led innovation, and why is that even important?
Yeah, that's a great question. So innovation has a multitude of definitions. So often people try to pin me down to what's the definition. There isn't just one, right? There's literally 8 or 10 definitions. What's important to know about innovation is that it's really around novel approaches or sort of repurposing existing solutions in a way that brings value. Maybe it saves money, or maybe it streamlines a process, or maybe it affords more people access. So it has to truly do something different. Innovation comes in 2 forms. It comes in very incremental, which is still very good, or disruptive, right? Like SpaceX, like Tesla, like Uber, things of that nature. So it's really kind of all over the board. It's hard to pin it down. When I talk about nurse-led innovation, what that really means is that in healthcare, or even in health, which means wellness as well, there is so much that really we could improve or transform. And to do that, it's going to have to happen with the help of nurses. So clearly I'm biased. I'm a nurse, and there are 4 million registered nurses. That means there are 4 times as many nurses as physicians, 8 times as many nurses as pharmacists. Nurses need to lead the charge. Yet we often are not equipped or trained how to use this skill set we have, and we don't understand the terminology. And kind of the hardest of those is that oftentimes tech companies don't approach nurses, but rather approach other clinicians when they're developing solutions. Mm-hmm. So nurses are going to have to lead the charge to truly transform health.
So when you say lead the charge, in my mind, there's kind of like 2 paths where it's like nurse turned entrepreneur, like we see some physicians have turned into entrepreneurship. And so they're kind of innovating their own solutions. And then there's this other path of, health innovators that are bringing solutions to market, and how are they weaving in the nurse's input at multiple phases of the product development process.
Right. So how I like to think about this is, if you were an entrepreneur that happens to be a nurse, or if you're a tech person that happens to be a nurse, if you're an innovator that happens to be a nurse, right? The nurse piece of it is kind of our superpower.
Yep.
So really it's about how is it you go down either the channel to improve technology or the channel to improve kind of care delivery or models of care, and you happen to be a nurse. So think about it this way. Oftentimes in the world of solutions, there are solutions that are developed, especially still today with tech companies. And many times these examples are brought to me, right? Companies will send me an invite and say, hey, we want to demo this product for you. So I look at the product and I'll say, what problem were you trying to solve? Right? Because the problem hasn't truly been refined or defined.
Yeah.
And they essentially have a solution that's looking for a problem. And oftentimes they spend hundreds of thousands, maybe even millions of dollars on this solution that really doesn't do what it was intended to do, because they're kind of off by a little bit. If nurses were involved in that equation up front in the design and development, we could actually help eliminate or speed up kind of that development, the R&D time, based on the fact that we could really help you zero in on the right problem to define and then approach it the right way. Mm-hmm. So nursing, I think, is really, it's been super, super quiet in this whole equation, but you're seeing right now people start to really raise their hands and say, we want to be or need to be included in these solutions or in the process to advance this work.
Yeah, absolutely. And I mean, there's so many different variables at play, but I have seen that you're right, that there are two approaches. One, I have a technology, let me go find a problem. And then I have a problem. And by the way, technology is going to enable us to solve this problem. And that's a big difference between success and failure.
That's right. It is a big difference. And what you said there was just key. Oftentimes, technology isn't the solution. It's part of the solution. Mm-hmm. And what nurses bring are the workflows, right? Yeah. We're the frontline people across the entire continuum of care, from entry to exit, whether it's home care, outpatient clinics, inpatient, no matter what it is, nurses understand the workflows. So in order for technology to truly be successful, we have to enable it and leverage it, but it also has to meet the needs of the workflows. Mm-hmm. So those pieces have to work hand in hand.
Yeah, absolutely. And I think that is just, I knew I was going to be excited about this discussion today because it is such a missing piece. As I've worked with technology innovators over the years, it's been a big push to try to get them to incorporate patient input in the product development process, right? As difficult as that was, I feel like we are making substantial strides in that vein. And then you have the providers and, incorporating them into the product development process. But I have not had one customer or client, not one company, talk about how they were incorporating nurses in this process. I mean, I'm just being really candid. And we've got to do more of it. Definitely.
Absolutely. And it's funny because I've even had, I demoed a product probably a year ago, 12 months ago, and it was an interesting solution. And I asked if they had nursing input, and they said, yep, we had nursing input. And I said, well, what kinds of nurses? And they said, well, it was surgeon. And I said, wait a minute, that's not a nurse. And they said, well, we've talked to a couple surgeons. Well, that doesn't give you our vantage point, which is very different. Sure. So while physicians are incredibly important to this equation, their vantage point and their viewpoint and their perceptions are very different than those of the nurses that remain in those kind of care settings much longer, much more. They're closer to the patients and the families. They understand those dynamics better. Yeah, so by not going there, you're really missing valuable information.
And it just seems so obvious when you say
It
it.
does. Well, and again, I would say, so some of this we've done ourselves a disservice, right?
Yeah.
So in nursing, we've not leaned into these conversations. We've not said we should be there. And we've
Hmm.
not sort of demanded a seat at the table to say we're part of this, right?
Hmm.
So now you're starting to see that happen. You're starting
Yeah.
to see nurses say, wait a minute, we need to be in this conversation. You're seeing people pop up around the country now. There are nursing people that are sharing this innovation passion. That's
Hmm.
incredibly important for us. And I think that's really sort of the start of the movement.
Yeah, that's awesome. So that kind of touches on, one of my next questions. When I'm talking about involving patients or providers in the co-creation process, there's a lot of fear associated with that, of and a lot of uncertainty. Where do I find them? Do I have to pay them? How much do I pay them? What if what if they give me advice and I don't agree with it? How do I make sure that, that I don't ruin that relationship, or that I don't just feel compelled to incorporate their recommendations and diminish the viability of this solution that I want to bring to market. So maybe just, it seems as though not just with nurses but in general, this whole co-creation process, let's talk about some of the barriers and how you think that those can be overcame.
Yeah, that's a really good point. So I think what's important there is that nurses, right, are professionals just as physical therapists, physicians, speech therapists, others. So everyone across that clinical spectrum should be treated the same way. It should not be
Mhm.
discipline specific. And
Yep.
it's really important to think that today cross-functional or interdisciplinary teams are the way we all operate. It is not driven by one profession or another. Those days are over. So now
Yep.
it's very, very equal across that continuum. So part of what's important is to set guardrails up front, right? So if you're a tech company and you're going to have these conversations and you want to harvest information, it's important to say up front, this is what we're looking for. And let us help you understand how this kind of works for us. We want to hear your feedback. We're going to incorporate the pieces that we believe are really going to contribute to advancing the product.
Mm-hmm.
Everything may not fit in with what we're thinking about.
Yep.
So that's important up front. Certainly having the conversation well in advance about, are we paying you to be sort of a subject matter expert, right? A SME or an
Mm-hmm.
independent consultant, or are we just picking your brain, on a phone call for 15, 20 minutes? Those things are different. What I am seeing more is a trend in that as nurses are being asked to provide information, if it's something that's kind of an hour or longer, I am starting to see tech companies being willing to pay for that.
Yep.
So I think that depends on the route that both the company wants to go as well as the nurse as an individual. I coach nurses to ask for money. Physicians are doing it. Nurses should be as well. The
Mm-hmm.
other thing that you can do is there's actually a really great organization. It's called the Nurses on Boards Coalition,
Okay.
nobc.org. You as a company can actually go to that website and then complete a profile of what you're looking for. And hundreds of thousands of nurses from across the country go there as well. So it's like a matchmaking service.
Hmm.
So if you're a company looking for nurses on an advisory board or on your board, that's where you would go to gather that information.
That's huge. Thank you for that.
Yeah.
I'm familiar with the company We Go Health, but their
Mhm.
platform is strictly patients, right? So their
Right.
entire business model is incorporating patients. And that was going to be one of my questions for you, is did they have anything similar to that for nurses? And it sounds like
Yes.
that's it. Okay. Awesome. So, help me just understand. I know that you're encouraging the nurses to ask for money, which I think is rightfully so. But if you just kind of overall, are is it better? Are you getting better insights if they are financially compensated? Or is it that you'll have some folks that are just really passionate about the cause and they'll contribute no matter what?
I think you're always going to have both of those scenarios, right?
Mm-hmm.
I think you're always going to have people that want to share their knowledge and their feedback from experience. And I think you're going to have people that are willing to share it, who may be more of the subject matter experts that get tapped a lot. And over the course of time, when you get tapped a lot, your time costs you something,
Sure.
right?
Absolutely.
So
For all of
that's right. So there's something that you need and should be compensated when it comes to being that subject matter expert on a regular basis. Then that's where it makes sense, to be paid just as you would pay a physician.
Mm-hmm. Yeah, absolutely. So the other thing that I want to talk about is, as we think about that whole product life cycle, there's a lot of discussion around including, stakeholders in the design process. But what I see is still missing, or we're just starting to scratch the surface, is talking around that whole ideation and
Right.
evaluation. So some of the steps that happen before. So instead of like, I have a product, what do you think about it? Like you talked about, really that ideation around the product and the solution development. And then I'm also seeing a little bit of conversation around including those stakeholders on the back end of that when I'm actually going to market. So in making these stakeholders like part of the marketing team, where they're actually key influencers, right? So they're helping to get the word out and rise above the noise. And they're also even helping to develop content. So just kind of speak to your experience with that.
Yeah, so what you're describing is really utilizing human-centered design or design thinking in a pretty
Mm.
deep and intense way.
Yep.
So human-centered design, or HCD, it always starts with empathy. So I think that we continue to learn. In the past, we've seen that as a really warm and fuzzy word, and we're like, oh, that's so sweet. Somebody has empathy. Now we've really learned to sort of turn this into kind of a quantifiable business approach, right?
Yep.
The more time we spend to truly empathize with what people are going through and why, that allows us to more clearly define the problem that we're trying to solve, or the problem that they have. So as we understand it, what's so beautiful about that is we really can peel it back about 5 times, right? So kind of, as I was trained in design thinking, what I was trained is that you ask 5 layers of why. So if the problem is that patients, for example, aren't showing up on time to same-day surgery, why?
Yep.
Well, maybe they can't find the signs in the hallway, the wayfinding's poor. Well, why is that? Maybe the parking isn't in the right place, and the parking doesn't kind of connect them as quickly to the fastest route. Well, why isn't that so? Why isn't that easier? Why isn't that obvious? Maybe the parking lots aren't labeled properly. Well, why is that a problem? Well, maybe because they're nervous and they're running late and there's traffic. Well, why is that a problem? Well, jeepers, maybe we're not informing them way back when that it will take 30 minutes to find their spot, park, walk to our office. So they need to add an extra 30 minutes to their process. Or do we have our same-day surgery entrance located in the wrong part of the building? Right?
Mm-hmm.
So I think as you really dig back, you can understand more about the whys. Once you figure out the empathy component, then you can move into defining the problem. And as you just described, that next step is going to be ideating. One of the things that we tend not to do well when it comes to ideation is that we're not very thoughtful and use divergent thinking, right?
Mm-hmm.
Divergent thinking means we just throw everything on the table, and later we converge those ideas. But we
Yeah.
want every idea, no matter how wacky and crazy, because some of them might have merit.
Right.
What
Right.
we tend to do in healthcare is, because we have such a low risk tolerance and aversion of failure, is that we actually sort out, even in our minds, before we share our ideas, those that are going to be silly or goofy or non-doable. So we're not very tolerant of risk. We don't have a tolerance of failure. So we already try to thin the herd, put the best ideas out there. And then as we move through, kind of that pipeline, what we end up with is something that's not too dissimilar than what we already have.
Right, right. Yeah. I have this team member who prefaces, whenever when we're doing strategic collaborations internally, she will say, this is going to sound really stupid. And I go, okay, the brilliance is coming, because that is when she's just really brilliant. When she thinks it's the most ridiculous idea, I'm like, gold.
Right. Well, and the other thing we tend to do, not only in nursing, but in healthcare, is we say, we tried that before.
Yeah.
You know what? Good. Let's try it. And when people like to say, oh, we've done that, like, that's awesome. Then this is V 2.0 or V 4.0.
Right.
But you got to get them out there because maybe the circumstances are different. Maybe the timing's different, the budget's different, the people are different, the building is different, reimbursement is different, caregivers are different. Something's different, but just because you did it that way before, it doesn't mean you can't try it again.
Yeah, yeah. So I feel like you have your ear to the ground. You have such an influence and a network, and so I want to get your perspective on this. I talk about this phenomenon of the difference between commercial success and commercial failure, and when we have this conversation, we really talk about the complexities and the difficulty of commercializing innovation in the healthcare space, especially compared to other verticals. So why do you think some innovators succeed and some fail?
I think it depends. If it's product innovation, you really need to do a super good job of solving the right problem and kind of creating a solid business case, right? We all know that the economics are very important. So when you develop a business model, you look at funding, you have to make sure it's sustainable. Then you have the whole market launch, you have the marketing piece. I mean, that's very complicated. In the nursing world, generally speaking, nurses aren't trained on those things. So they really have to kind of find ways to address those issues and try to fill some of those gaps. And it's not dissimilar that physicians aren't trained that way either. Right. So what we tend to see is that oftentimes physicians, when they launch an idea, they can be more successful just because there is an income differential. So sometimes that they're starting from a different place financially. Right. But we do see a lot of very, very successful nurse innovators and nurse entrepreneurs.
So give us some examples. Who's doing it well?
So there's actually two guys out of New York, Dr. Paul Coyne and Mike Wang. They started a company called Inspirin. They're two nurses. They noticed that there were safety issues with their patients, so they developed this thing that's called IN. It's a cognitive patient assist device that they brought in. They spent their own money on this and brought in some NASA engineers and actually designed something that uses kind of the cloud, right, AWS, and it uses purposeful movement tracking. And essentially what it does is it can tell if a patient's moving in a purposeful manner or an unsafe manner. The device changes colors, kind of the red, yellow, greens, to alert people as to whether or not there's a safety issue. And then it also sends an alert to the nurse and the tech's phone to let them know that a patient is potentially in an unsafe situation. It can also track to know who's in the room, how long someone's in the room, those kind of things. So they're able to run reports if you're on a unit and you might have a high VAP rate or a pressure ulcer rate, they can actually run reports that show how often caregivers, they can break it out by nurses or PCTs or CNAs, have been in the room. So that's an amazing product. Joe Novella out of Oregon, he actually designed and developed a staffing and scheduling software, NurseGrid, that's absolutely amazing. Tiffany Kelly, she developed an app that can be used for giving report that allows nurses to do it on their phone and have that information in their pocket. But there's tons and tons of examples out there. I could literally go on and give you probably another 10.
That NurseGrid thing is fascinating because it's like my initial reaction is, do we really need another scheduling platform? So there must be doing something really unique and different that create that value and create their own space in that category.
And he's been around for a couple years and he's a nurse. So it was designed from a nurse-centric view.
Right.
And they have tons and tons of users, and it's sort of schedule agnostic. So it actually incorporates different schedules into it, and it allows you to look at your view very differently, and you can communicate it and share it with friends and family and stuff. So there's some really amazing stuff that nurses have done that are out there, and I see that as continually growing. So I love to talk about that and help nurses who have an idea in their head, get it out and develop a business plan.
Mm-hmm. Absolutely. So you recently left the American Nursing Association,
Yes.
hot off the press. I think just as of this week, that press release went out.
Yes, that's right. I just left. So Wednesday was my last day. That's right.
So tell us a little bit about what you're doing next and how that's exciting for you.
Yeah, it's real bittersweet. I mean, the American Nurses Association is a great, great organization. They've been around for 25 years doing really amazing stuff. I'm super, super honored to have been the first Vice President of Innovation. I created the role. I created the innovation framework for them. I developed what's called Nurse Pitch, which we've done 3 of those very successfully. Have developed their innovation lab platform. That's been a blast.
Wow.
So it became apparent to me that I really, really get excited by this innovation stuff. So as I started to build relationships with tech companies across the country, kind of developed some really good relationships to the point of saying, hey, what could we do here with this company and how might we really leverage this skill set so that we could make a difference, a true impact to patients and nurses with this particular product. So as of next week, I will be working with Wambi, which is a patient engagement and a staffing kind of a nursing recognition platform. And it's powered on gratitude. So never in a million years would I have thought that I would have left a job to work for a tech company, except this company is incredibly unique.
Uh-huh.
And it doesn't work based on sharing data and pushing hard on people who aren't performing, but rather it works by patients and their families showing gratitude and recognizing their caregivers. And then through a gamified approach in the dashboard, people want to compete to be in the top couple of places. So it really helps to bring everyone up instead of pushing on those that aren't performing well. Because we all know that has kind of a crummy feel to it, right?
Right, right.
But when you have people that are wanting to compete and be number one, that's a whole lot more fun. So that's the approach. And I'm really excited about shifting to that company next week.
That's awesome. So what's going to be your role?
Yeah, so I'm going to be the chief clinical officer, really focusing a lot on thought leadership, clinical innovation, strategic partners to obviously to help grow the company, but also make sure that we're making an impact in the lives of nurses and patients. So
Mhm.
that's important.
So your personal mission and cause hasn't changed one bit.
Hasn't changed one bit. Well, and of course, I would say I'm putting in a plug here, but I am going to be speaking, and already I'm getting emails from people that are very, very interested in having me come in and speak for their events and things of that nature, even doing workshops on innovation. So I think there's so much out there that we can continue to do for our nurses.
That's awesome. Well, congratulations on your new role. I look forward to seeing all that you're going to do for that company going forward.
Excellent. Thanks. And we have a book coming out in August, The Nurse's Guide to Innovation. So that's going to be pretty cool. And that's kind of a culmination. There are 8 of us that are authors on that. And they are the
Okay.
most common questions that I have received as I've traveled around the country in the last 2 years from nurses around building a business plan. How do I become an innovator? How do I write a business plan? How do I secure funding? How do I protect my intellectual property, which, as you know, is a huge problem.
Hmm. Hmm.
And how do I engage nurses in my hospital, my department, my unit, so we can solve problems more collaboratively? How do I use design thinking? So we wrote a book on it. So that's pretty cool, and that's coming out soon.
That's great. You'll have to let me know when it's ready and I'll help promote it for you.
Wonderful. Thank you.
One of the last questions that I have for you is, we talk a lot about like patient adoption and physician adoption. So from your perspective, what are some of the strategies that you would recommend for our health innovative listeners who are launching innovations and they are struggling with nurse adoption?
So I think there are a couple of ways. First, make sure you get input, right? It's hard to solve a problem and think that you have the solution when you haven't defined the problem accurately. So I would say start up front, ask nurses for their input, their feedback. There are ways to do focus groups. There are expensive ways you can do focus groups if you're a big, well-funded organization, or there probably are cheaper ways that you could do focus groups. Pay attention to what's going on in social media. There are some of us nurse influencers that are really pretty active. So I have people reach out to me probably 100 times a week that ask me if I can connect them with somebody, or do they know someone else that's working on this or something. So I try to matchmake as best I can. I try to answer questions as best I can, or send those that are inquiring, I send them to others to kind of find some solutions.
Mm-hmm.
So that's really one way to do it, through social media. Look at the nobc.org site. That's another way to try to get input on your advisory boards and your boards. And then I would say just stay really, really close to the ground on what's going on and what's contemporary in nursing practice. And the
Mm-hmm.
best ways to do some of those things are looking at the conferences going on, or what's being, written when you do kind of a Google word alert or something. You'll find out what's going on with that particular topic or idea.
Sure, that's great. So that leads me to my last and final question for today is how can people get a hold of you if they
Oh, yeah.
face with you? What's the best way?
So I'm very active on social. So I'm actually, I think, the top 2 or 3 number nurse influencer on LinkedIn. So I have a LinkedIn profile. Feel free to connect. I really do correspond with people pretty regularly. I'm also pretty active on Twitter. So I'm at Thought Leader RN on Twitter. And then I'm just starting to get into Instagram because I love just the ability to be very visual and have people respond to that. So new to that platform, but that's getting to be a blast so far. And on that one, I'm RN, INNOV, and the number 8, RN
Okay,
Innovate.
love it.
So there's some really cool ways to reach me that are out there. And if people want to find me and they look hard enough through my LinkedIn profile, they'll actually get my email as well.
Dig deep, right?
Dig deep. That's right.
Awesome. Well, thank you so much for sharing your wisdom today with our listeners. I really appreciate it.
Yeah, it's been awesome. Thanks so much.
Thank you.